Why do I have spotting after a cervical cancer colposcopy? Spotting after a cervical cancer colposcopy can be concerning, but it is often a normal part of the healing process. During a colposcopy, a healthcare provider examines the cervix closely using a magnifying device. This procedure may also involve taking a small tissue sample, known as a biopsy. The cervix is sensitive, and even gentle contact can lead to minor irritation and bleeding. When a biopsy is performed, it creates a small wound on the cervix. This wound needs time to heal, which can result in light bleeding or spotting for several days afterward. You might notice some vaginal discharge that appears brownish or tinged with blood. This is typically part of the normal healing process. In addition to spotting, some individuals may experience mild cramping similar to menstrual pains. This discomfort can accompany the bleeding and is generally not a cause for alarm. Spotting might also be linked to underlying cervical conditions, such as cervical ectropion. This benign condition occurs when glandular cells from inside the cervical canal are present on the outer cervix, making it more susceptible to bleeding after examination. To manage spotting and promote healing after a colposcopy, it is advisable to avoid vaginal sex, tampons, menstrual cups, swimming, and vaginal medications or creams until the bleeding or spotting has stopped. This usually takes a few days to a week. Using sanitary pads is recommended for managing any bleeding rather than tampons, which can introduce bacteria and irritate the cervix further. If you had treatment to remove abnormal cells during the colposcopy, it is possible for spotting or bleeding to last longer, potentially up to for weeks. The same precautions apply in this case. It is important to monitor your symptoms after the procedure. If the bleeding becomes heavy, lasts more than a week without improvement, or is accompanied by severe pain or signs of infection, it is crucial to contact your healthcare provider. In summary, spotting after a cervical cancer colposcopy is usually a normal response to cervical irritation or biopsy. It typically resolves within days to weeks and reflects the cervix's healing process. However, persistent or heavy bleeding warrants evaluation by a healthcare professional to rule out any complications. Always consult with your healthcare provider for personalized advice and guidance.